Hi everyone, welcome. I'm making pharmacology summary for the NCLEX IN exam. In total, I have developed them into 3 PowerPoint. The first one will be about category, then to according to human body systems and the drug classes. And after that, I will summarize them again in adverse events and side effects in total. And then afterwards, I will talk about pharmacology, lab value, antidotes, contraindications, etc. So let's get started with the first one, pharmacology in total summary. Before we begin, you can download the template. This presentation is for the purpose of research and private study. I used Kaplan, UWorld, Registernus, and NCSBN and other resources. Pharmacology, I have category then according to different topics. Here is the human body system and here is the drug classes. And I will show you each example of it. Now, I am on the way, am I? Okay, so I do a heading here. This is to do with cardiovascular medications, and that's the function. It decreases heart rate, decrease blood pressure in most of them, those 3. But it doesn't, for digoxin, it doesn't do much with the blood pressure. It's mainly decrease the heart rate. Drug class and the actual drug, and then if they got the blood value, then you write it down here. Give a bit of definition what they do in the body, and then write down the side effect and adverse effect you should know, because it's gonna NCLEX IN gonna ask you. For example, here calcium channel blocker, the PIN. You write down the last similar one, acronym, and then just remember it. And then what does it do to the body? And then the facts we need to remember for the exam. Take selective beta blocker, for example, NCLEX, and then it works only on the heart. While non-select beta blocker, LOL, works on the heart and the lungs. And that's why we have side effect of bronchospasm here, but there's no bronchospasm here because it only works on the heart, not on the lung. For non-selective beta blocker, because both end in LOL and LOL. So in order to differentiate, I do STMP. Okay. So instead of stop, I write SNOP. Okay, here it decreases blood pressure. Okay, it decreases blood pressure. So here in summary, no matter what medication you give, then you need to check the blood pressure first. Make sure it's not too low, it's within standard before we give the medications. Afterwards, we want to educate them to sit for a while. If they're getting up slowly rather than quickly. I have summarized sort of my understanding of blood pressure, heart rate, and respiratory rate in different situations. For example, if patients are on shock, they will have decreased blood pressure, increased heart rate. And then that's why we administer IV fluid, because it's gonna increase the blood pressure and decrease the heart rate. So it's important to know the condition, what happened to the blood pressure and heart rate, and why we give in certain treatment and medications. Calcium C, we will have I am on everyone's way. So calcium C, here it's antiplatelet, anticoagulants, anticoagulants. So for this table, it's all about risk of bleeding. So here I just write a total summary of like signs and symptoms of bleeding that might occur and what you should do. Because no matter which one you come to it, the question, one of the questions will be about bleeding. They give you signs and symptoms of bleeding and then tell you what you should do, like what can you do next. Next one is about diuretics. The main point to take out for diuretic is potassium sparing means it's safe potassium, so you get hyperkalemia. While the rest of other diuretic, they don't save potassium, they get rid of potassium, so that will result then from hypokalemia. So here I just make a final summary. Hyperkalemia with it work on potassium sparing diuretic, but for the rest of diuretic is hypokalemia. So you look at them and comparing them and then just do a final summary. Here is statin, which reduce cholesterol in our blood vessels. And then here's the side effect or adverse effect we need to remember, and facts to remember, like avoid grapefruit or given at empty stomachs. So the question would say, patients on statins, what should we avoid? So we need to avoid grapefruit. Respiratory here, we're talking about bronchodilator. And then again, what does it do to the symptoms? And then the side effect and adverse effect we need to know. Respiratory inhaled corticosteroid and corticosteroid systems, bit of definition, and then what they should, what we need to know about side effect and adverse effect. You can also add management and treatment to those adverse effect. I'm gonna move here. GI, I take pantoprazole, for example. Give a bit of definition and then adverse effect and things we need to remember. Endocrine, this is my summary note. We got rapid acting, short acting, intermediate acting. How I remember is rapid, for example, short acting, Novoloc, it has an R here. Well, here Novoloc, there's no R, so it's rapid acting. If it got R, then it's short acting. If got N, it's intermediate acting. And then long acting, you just have remembered. I got these tricks from registered nurse RN. She told me how to memorize, because I was having problem to memorize one by one, which at the end of the day, we're gonna forget about. So make yourself a systemic way of remembering, then it will be much easier. Next one is about endocrine oral hypoglycemia, oral hypoglycemic agent. Again, we all know it's gonna reduce the blood sugar level, so it's important to check the blood sugar level before we give it. And of course, watch out for those side effects. Here we got normal opioid analgesic, acetaminophen, ibuprofen, aspirin, etc. And then what they're gonna affect on. For example, here I write not photosensitivity, so that means this medication does not cause photosensitivity. Because in one of patient I made a mistake, so I just write that to remind me for these drugs it does not cause this. And then for NSAID's drug class, I thought acetaminophen was belonging to this group, but it's not, it's belonging to here. So if you made a mistake in the question, don't hesitate to write here, so it's easy to differentiate the difference and your mistake, and next time you know that you will not make the same mistake. So opioid and narcotic, acetaminophen. So if patient pain is less than 5, we can give acetaminophen. If they got 5, then we can give hydrocodone or acetaminophen again. If it's over above 5, we give morphine and or hydromorphine, because for example, hydromorphine is 5 to 10 times the strength of morphine. So if you give it to patient who's just complain of pain of 4, then it's too pain scale is too low for it. Acetaminophen would do, because the question would say patient complain of a pain scale of 5, like what medication do you give? And we know that we don't give morphine and hydromorphine, so we got option of hydrocodone and acetaminophen. Chemotherapy here, the main point to remember is infection status, immune systems. Especially when we give active vaccines, we need to make sure that they are not live vaccines, because patients on chemotherapies, they got one of side effect is immunocompromise. Antidepressants. Antidepressants tend to have how do I say, like this one, they got the blood volume that we need to remember, and then they got quite a few side effects we need to watch out as well. Antipsychotic, we categorize them into first class, second class, and third class. First generations tend to have, first generation, second generation, third generation. First generation tend to have more side effect compared to the second and third. So when the NCLEX questions ask about antipsychotic, firstly you need to figure out which generation they belong to, and then what they do, and then the side effect to it. Antibiotic. With antibiotic, how do I say? We just have to remember the side effect and adverse effect. But I group them into different categories as well. In my next presentation, I will show you an example how all of this can summarize into a easy way of memorizing them. For example, for photosensitive, in my summary of next PowerPoint, I will do photosensitivity and then which drug will cause photosensitivity. So it will be this one and this one, and then I'll write down the acronym as well. Here we got anti. So here is anti-TB, tuberculosis, anti-infective, antifungal, anticonvulsant. So I categorize according to the ANTI. And then this adverse effect and side effect we need to know. And then others. Here is a group that I don't know where they should belong. It's only probably just one, like this one. Smoking cessation aid is the drug classification, and nicotine. And then I'll just write down the notes we need to remember. And that's it for my presentation for the pharmacology section. I know it's a lot, but that's the basic fundamental knowledge we need to know for the pharmacology, because it's gonna pop up in the question. I think it's worth 15%, which is a lot. In my next presentation, I will make it simplified and hope this will make it easy for us to remember.